Welcome back to Ophthalmology for undergraduates and postgraduate beginners. In the video just you saw a wing-shaped growth on either side of the cornea, that is in the interpalpebral region of the bulbar conjunctiva, encroaching into the cornea. This is what is called as pterygium. Pterygium means wing. That's why it is named like that. Today we are going to discuss about this common presentation that is going to be kept in the examination for undergraduates, that is pterygium. In the patient you just saw, the patient told that this wing-shaped growth started somewhere between the age of 20 to 30 years. Somewhere in that age group it started, and that we call it as insidious onset, and it has slowly increased in size over several years and it has come to the present size. This is present in this person because he is an agricultural worker who has been constantly exposed to a hot, dry climate and a dusty atmosphere. So pterygium is very common in people who are exposed to a chronic hot, dusty environment. Our patient presented with the following complaints. One is irritation in his eyes is present. The second thing is the vision is gradually getting reduced over a period of so many years. There is no history of diplopia. There is no history of diplopia in this patient. This is a significant history we have to ask in a patient. Apart from this, whenever a patient has such a wing-shaped growth in the eyes, they will have a cosmetical problem. They will always be worried that they do not look great. That is a cosmetic problem. But this patient, being an agricultural worker, he is not bothered about his outlook. He is more bothered about his irritation and foreign body sensation and little bit of decreased vision. On examining the patient, I was able to appreciate on either side of the cornea a thick, fleshy, vascular growth encroaching into the cornea for about 3 millimeters. This we call it as a double pterygium because it is present both on the nasal side and temporal side. Some people, it may be present only on the nasal side. When we closely observe this pterygium, the pterygium has 4 parts. One is the head, which is on the cornea, the neck, which is opposite to the corneoscleral junction, and the body, which is in the bulbar conjunctiva. In front of head, we see multiple whitish infiltrations. I have drawn here in blue color, but it will be white in color. This we call it as Fuchs spot. This we commonly call as cap of the pterygium. So whenever we see such a picture in the eye, we can come to a diagnosis that this is a case of nasal and temporal pterygium of a progressive type. Because this patient is having a thick, fleshy vascular growth, and in front of the pterygium you have the cap, and we call it as a double pterygium. Recently, pterygium has been brought under 3 types: type 1, type 2, type 3. Type 1 is encroachment into the cornea up to 2 millimeters. Type 2 is encroachment into the cornea between 2 millimeters and 4 millimeters. Type 3 is encroachment into the cornea more than 4 millimeters. According to this classification, we can say the pterygium in our patient has encroached into the cornea for about 3 millimeters, so it falls into the type 2 category. Suppose the pterygium grows further, that is more than 4 millimeters, what will happen? This is going to come into the pupillary zone that will affect the vision significantly. In our patient, the final diagnosis for the right eye is nasal and temporal progressive pterygia, because there are two pterygiums of type 2. It is due to involvement of the cornea for about 3 millimeters. Progressive pterygium because the pterygium appears thick and fleshy, it is vascularized, it is having a fugue spot in front of the pterygium that is called as the cap. Before going to the management or treatment of pterygium, we should know what are the stages of pterygium. Pterygium can be an early pterygium like this, where the growth is present only in the bulbar conjunctiva, which is fleshy and vascular, but it is very, very small. It has not encroached into the cornea. The second type is what we saw in our case, a progressive type of pterygium, where the growth was thick, fleshy, vascular, and it has already encroached into the cornea. In front of the head of the pterygium, we saw the cap. The third stage is a regressive stage of pterygium. As the patient gets older and older, what will happen to this pterygium is, this pterygium will lose its vascularity. Because of its losing its vascularity, the pterygium will become pale. It will not be vascular, it will not be pinkish in color. It will become whitish or yellowish in color, and there will not be any cap in a regressive pterygium. Finally, when the patient gets very, very old, this avascular pterygium becomes wrinkled, attenuated, and atrophic. You can see here the pterygium has become wrinkled, atrophic, and it has become very, very thin. When we closely watch these patients with this type of atrophic stage of pterygium, we can see a red line in front of the head of the pterygium, that is deposition of iron in front of the pterygium in the line. That is called as the Stocker's line. We call this as a Stocker's line. So this is due to pooling of tear fluid at the junction between this growth and normal cornea. The tear fluid contains iron, so it gets deposited at the junction, leading to a Stocker's line. So this we should know before going to the management of pterygium. Early pterygium can be managed under two situations. If the patient says he cannot accept the cosmetic problem he is having, we have to go for removal of the pterygium, that is excision of the pterygium has to be done, and we have to prevent recurrence by asking the patient to wear ultraviolet or dust protective goggles. So the sun rays directly do not fall on the eyes and dust does not enter into the eye easily. So you know that ultraviolet rays is one of the main etiological agent for development of pterygium apart from dust. Otherwise, we have to ask the patient to use tear substitutes. Tear substitutes are artificial tears. So this will try to keep the eyes cool, eyes lubricated, and it also will wash away the dust from the eyes. If the patient can accept his cosmetic problem, he is not worried about that, then we can advise UV and dust protective goggles for the patient. We can give tear substitutes. Apart from that, we have to frequently follow the patient, looking for the progression of the pterygium, and suppose if the pterygium is about to encroach into the cornea, we should do a surgical removal of the pterygium. When the pterygium is a progressive type of pterygium, just like what we saw in our case, particularly when it has encroached into the cornea, the choice of treatment is we have to excise the pterygium. We have to remove the pterygium. But if you remove the pterygium alone, you will have the following problems developing. One is Since this is a progressive type of pterygium, this will going for repeated growth, that is recurrence. The other problem we are going to face is the pterygium has involved the cornea. It has spoiled the Bowman's membrane and the superficial stroma of the cornea. These portions, once they are damaged by this pterygium and once the pterygium is removed, these portions will be filled with fibrous tissue and that will lead to a corneal opacity. That will be a permanent corneal opacity that will create a cosmetic problem for the patient. So what we have to do is, we have to do a lamellar keratectomy. The affected portion of the cornea should be removed. Affected layers, that is the Bowman's and the superficial stroma, has to be removed. And to prevent the recurrence of the pterygium, we have to do a conjunctival limbal autograft. Conjunctival limbal autograft, you can see in the picture above. We remove the portion of a conjunctiva superior to the cornea and we suture it in that area we have excised. Or we can use a amniotic membrane graft which has been procured from the OG department after thoroughly evaluating the amniotic membrane and clearing of all the infections. We can also try Mitomycin medicine, which is about 0.02%. Once we excise the pterygium, we can apply this Mitomycin for 3 minutes in that area so that whatever the remaining cells are there, abnormal cells are there, those cells will take up this Mitomycin and they stop growing. And for the corneal opacity, which we have to prevent, we have to do a lamellar keratoplasty. We have to just replace the portion which we have removed with the donor cornea, which is having only the Bowman's membrane and superficial stroma. This is a complete treatment for a progressive type of pterygium which has encroached into the cornea. If the progressive type of pterygium has not encroached into the cornea, we need not do this lamellar keratectomy, we need not do a lamellar keratoplasty. We can just do this excision and grafting or Mitomycin C alone. In the case of regressive type of pterygium, where the growth has become devoid of any vascularity, there is no cap, the growth is appearing pale in color, then simple excision of the pterygium is enough, because there is not going to be any recurrence in this case. There is no need for any type of graft in this case, and there is no need for application for Mitomycin also. But if it has involved the cornea already, we have to do a lamellar keratectomy and do a lamellar keratoplasty to prevent the corneal opacity. If already the pterygium has become atrophic, then it depends upon the requirement of the patient. If the patient says he does not want any surgery, we can just give goggles for the patient, or you can just stop with the tear substitutes in the patient. You need not give anything, because slowly this atrophic pterygium will become very thin and thin and thin and will become membranous. There is no need for treatment unless the patient needs a cosmetic remedy for him. Suppose the patient needs a cosmetic remedy, once again you have to excise it, we have to do a lamellar keratectomy and we have to do a lamellar keratoplasty. That is what we should do. In all stages of pterygium, even after giving all these types of treatment for each stage, the patient should be advised to wear protective goggles against UV rays and dust particles. Patient should be given tear substitutes to prevent foreign body sensation and irritation in the eyes. Pterygium is a very important topic. It is an elaborate topic as far as undergraduates are concerned. So we will stop this video here, and in the very important next video we will discuss about the common questions that will be asked about pterygium in the examination.